Most people are aware and have knowledge of what the placebo and nocebo effect are, but they have the understanding that it is focused on a treatment, on a pill, or any other kind of treatment that a person receives. But what most people are not aware of is that the strongest placebo and nocebo effect are not so much on the remedy, but on how the person receives an interpretation on what's happening in them. This is commonly known as a diagnosis also. And the way a person receives a diagnosis has an impressive effect, either a placebo effect or a nocebo effect in their health. And this manifests automatically, short-term and long-term also. Depending on how the person receives the information, the attitude, the words that the doctor or the therapist or whomever is giving this interpretation of their health, of their condition, this is going to determine massively the path that their system, their body is going to take, either on a healing path or on a deteriorating path. So when we bring awareness to this, and when we realize that we have a choice in this, we always have a choice on how to receive information or input from any other person. It doesn't mean that even if it's a doctor or an authority figure, we need to receive it as a truth and we need to assume that that is true, that what they are telling that is right or wrong with me is true. It's always an opinion. It's always an opinion. And once we become aware of this, we always have a choice to receive it or not. Anything we hear in the media, anything we receive from a doctor or a therapist or anybody, it's always an opinion. So there is where comes the option for anybody to inform themselves, to do research, to find other perspectives, to get different opinions. This allows ourselves to grow our criteria and our experience and not be so vulnerable to the opinions of others, to the diagnosis of others. That's why I always invite anybody. I don't tell my patients what's right or wrong with them. I give them different perspectives for them to be able to choose and have freedom. I give them different sources of information, which empowers them. And this gives a lot of responsibility to the individual. And I feel this is incredibly valuable when somebody takes responsibility for their life, for their health, for their own body. This is incredibly empowering. And this, I feel, should be what doctors should be doing, empowering their patients, not scaring them, not taking responsibility away from them, but empowering them, informing them, giving them resources.